Hi, this is Clarence, and this is Jackie. We're going to be talking about aspirin and the effects on colorectal cancer. Sit back and enjoy the video. What is the colorectal cancer? The colorectal cancer is a malignant tumor that affects the cells in the colon or the rectum. It is an uncontrolled cell growth that can spread along the inner linings of the organ. These cells in the colon or rectum will go through an abnormal physiological change which affects the normal functioning of the colon or the rectum. The function of the lining of the wall is to help produce mucus that helps waste products move through the colon and rectum efficiently, in which the cancer obstructs this kind of function. Now, what is the colorectal? The colorectal is a term used to describe both the colon and the rectum. Both the colon and the rectum are grouped together because they are connected with the same tissues that there is no clear distinction between a separation. These two parts are part of the large intestine and digestive system. The colon absorbs water and nutrients and passes waste products such as stool or feces through the rectum. Into the epidemiology of colorectal cancer. Colorectal cancer is one of the top 2 deadliest of all cancers. It is ranked second behind lung cancer and followed by prostate cancer and breast cancer. In 2016, there was an estimate about 134,490 new colorectal cancer cases, in which there were 70,820 were males and 63,670 were females. There were 49,190 colorectal cancer deaths, which has a case fatality rate of about 37%. Thus, colorectal cancer remains a heavy burden amongst the Canadian population. However, incidence and mortality rates have declined over the several years due to many lifestyle factors and medications such as reduction in red meat consumption, stop smoking, and the use of aspirin as medication. Between 2000 and 2013, incident rates in adults over 50 years declined about 32%. 30% to 40% were more susceptible in males than females. Signs and symptoms of the colorectal cancer. Some signs and symptoms of colorectal cancer are bowel habit change, which includes sessions of diarrhea or constipation. Changes within the consistency of your stool which last more than 4 weeks. Visible blood in your stool due to rectal bleeding. Presence of pain in the abdominals in the form of cramps, gas, or pain. The feeling of having an incomplete emptying of the bowels. Feeling fatigue or weak, and weight loss. Causes of the colorectal cancer. Researchers have conducted studies on large groups to figure out what causes colorectal cancer. However, through research, there are no clear reasons as to what causes colon cancer. However, there are many risk factors that contribute to increasing the risk of susceptibility to colorectal cancer. Some of the risk factors as mentioned is smoking, red meat consumption, older age, majority of the people age over 50 years, race or ethnicity, African American race have a greater risk, inactivity, environmental factors such as pollution, genders, which males are more susceptible than females, and alcohol consumption.
What is aspirin? It's one of the most commonly used drugs in the world and comes from salicylate in the form of a willow bark that is found in willow trees. Aspirin is most frequently prescribed for the prevention of heart disease, but can also be used to treat or relieve mild or chronic pain and reduce fever or inflammation. It's made up of a synthetic compound in the form of a non-steroidal anti-inflammatory drug. So what is aspirin used for? The common uses for aspirin include headaches, colds and flus, sprains and strains, and for long-term conditions such as arthritis. It can be used at low doses to prevent blood clot formation, heart attacks, strokes, and colorectal cancer. In high doses, it can be used to treat diseases such as rheumatic fever and rheumatic arthritis. There are many side effects when taking aspirin. Some of these side effects include dizziness and blurred vision, drowsiness, fatigue and depression, dehydration and sweating, abdominal discomfort and bloating, and nausea and heartburn, and diarrhea. There are also long-term effects using aspirin that include anemia, which is low blood count, bruising and abnormal bleeding, inflammation and bleeding of the stomach, reduced kidney and liver function, and the development of an allergic type reaction in both children and adults. So now on the topic of why aspirin is used to help prevent colorectal cancer. Over 600,000 men and women worldwide die of colorectal cancer each year. A study done on aspirin and the prevention of colorectal cancer suggests that aspirin has been associated with the lower risk of death from colorectal cancer. Taking doses as low as 325 milligrams a day reduces that risk. And the optimal dose of aspirin recommended is between 81 to 325 milligrams daily. Most frequently reported serious adverse events associated with regular aspirin use are related to gastrointestinal bleeding. And for many individuals, the benefits of long-term use of daily aspirin for prevention of chronic disease may outweigh the consequences associated with the increased risk of bleeding. A study done on a randomized trial of aspirin to prevent colorectal adenomas suggests that aspirin has an antineoplastic effect on the large bowel. With extensive observational data collected, it strongly suggests that persistent aspirin use reduces the risk of colorectal neoplasia. And about 10 to 20 years of treatment using aspirin is required to lower the risk of colorectal cancer. Another study done on the long-term effects of aspirin on cancer risk in carriers of hereditary colorectal cancer shows that after a long-term follow-up, dosing with 75 milligrams or more of aspirin per day for several years reduced death from gastrointestinal cancers such as the colon. It is used as a delayed cancer chemoprevention, so in regular aspirin users, it took about 10 years for cancer to emerge, which is also dependent on continued aspirin exposure.